Three. Welcome back to a new episode of the channel Optimize Yourself. Tonight we have a special guest, Ziyad. He's a pharmacist who has also become an entrepreneur and an author. He's known for sharing his journey and strategies for other pharmacists to build profitable businesses and create multiple income streams without leaving the profession. Ziyad, the floor is all yours.
Hi, thank you so much for having me. It's a pleasure. Hi, everyone. My name is Ziad. As Matt has said, that I am a pharmacist in Ontario. I am also um, an entrepreneur, so I started recently. Um, so right now I'm working full time in Shoppers Drug Mart, and I'm also doing my thing on the side, which we will be talking about in this interview.
Amazing. Thank you for being here. So let's start from the very beginning. So like in terms of the journey and like the challenges that you face along the way. So can you walk us through your journey moving to Canada and what inspired you to pursue the pharmacy program in the first place?
Of course, yeah. So I came to Canada in 2018. So believe it or not, I was one of those people who wanted to be a pharmacist since I was a kid. I pursued a pharmacy degree. I'm from Egypt, so I finished my degree and college in Egypt. So I finished in 2018, and after I finished, I came to Canada right away. In terms of doing the PEBC, that took me, so I started technically from 2019 after the document evaluation, and like it takes some time. So I started preparing since 2019, and I did my first exam, which is the EE in 2020, and I finished in 2022. So basically, like about 2.5 to 3 years. Some people would finish it faster, but I took my time in the preparation part because my goal was to pass from the first attempt, like all three exams, which I did. So that's why like it took me a little bit of time. So I was licensed in November of 2022. I started working as a relief for a bit, but then I got a full-time position in Shopper Drug Mart, and that's where I'm at right now.
That's amazing. And what would you say were some of the biggest challenges you faced during the licensure process and how did you overcome them?
That's a good question because, like, as a new immigrant and also someone who don't know like how to prepare for the exams, you will receive an overwhelming information from everyone. There are a lot of preparation courses, so like you have a lot of things that you want to like decide in terms of the preparation. So I guess this is one of the most challenging thing for like a newcomer to Canada. Um, that's why it took me also a little bit of time to find the right material. But at the end of the day, my conclusion was there is no perfect one material that you can study from, but you have to do your due diligence in finding multiple sources and compile them basically into like one book or one resource. And that will be the main resource for you to prepare. So that's what I did for the two exams for the EE and the MCQ. So I tried to find multiple resources and I compiled them into a huge resource, which is basically customized by me. And I still have those books till now, like I use them as a reference. But like I think that's one of the most challenging thing is to just find the right material and take your sweet time in preparation. Like I know some people would have certain or different circumstances, but taking your time in preparation, that will make a difference because like that will cut your journey into, I believe, in half. Instead of you like going into an exam, you're not prepared, so you fail, so you do it again. So that's time and money.
Yeah, I agree. And that's actually something which I have faced as a pharmacy student, like having multiple resources, like CPS up to date, and then like the lecture slides, and basically combining them into one single resource, which you can easily navigate and find the relevant answer to like whatever question you come across.
Exactly. Yeah.
And how would you say those early struggles shaped your perspective on pharmacy and personal growth?
Um, I guess it's very humbling, like when you go through the process, because it takes a lot of time, a lot of mental effort, because like at the end of the day, you only have three trials per exam, like fourth trial under certain circumstances. But that puts a lot of pressure on you. So after you finish, again, like it humbles you and you appreciate what you did. And um, yeah, I guess when you work as a pharmacist, you start to appreciate more like what you did. And also when you see a lot of people in your position and they ask for your advice. So that reminds you of the journey. It was not easy, and but it's worth it.
Yeah, that's definitely true. And so moving on to like digital content and creativity, which is also another thing which you have been doing. Um, so what inspired you to become a digital content creator in the pharmacy space?
Yeah, that's an amazing question. So since I was, I guess, maybe a teenager, I wanted to start something online, but I didn't know what. Back in my days when I was a teenager, like online things were not like a big thing as of now, but I just had the idea, but I didn't act or focus too much on it until I came to Canada, or actually to be very specific, until 2020 when COVID hits and everyone was at home. So you had a lot of time to like think and like rethink your choices in life, I guess. So I've seen a lot of people doing a lot of money doing something called drop shipping. So that was in 2020. And it was a good opportunity. So like I didn't know what that means, like drop shipping, right? So I started researching the topic and I created a store. I ran Facebook ads because like you have to get traffic into your website. By the way, I was selling resistant bands because like a lot of gyms were closed. So I thought maybe that's a golden opportunity, right? Like sell those resistant bands. People can work out at home. But I didn't actually get any sales at all. So like the outcome was by negative because I spent money on like ads and I didn't get any in return. So that started the journey. And then I moved on to something called Amazon FBA. So basically it's the same concept, but instead of having virtual or like stock from China, you would have the stock physically in a warehouse, whatever in the US or in Canada. So I made a notebook, like a study notebook I designed, and I purchased a lot of quantity from China, which is like 1,000 unit, which was a lot, I know. But I was taking a leap of faith, basically. So I spent a lot of money on that. And I stored it in a warehouse in the US. But again, I put it on Amazon, but I didn't get any sales. So after a while, I thought like maybe entrepreneurship is not for me. So I focused on my career as a pharmacist. And then again, like I am always thinking about that. So I started a blog called Simplified Pharmacy. So I was writing basically some blogs on like topics for the PEBC and something that I was interested in. So the idea of a blog, for everyone who doesn't know, that basically you write some blogs and you get some traffic to your website, and that's how you make your money, like through traffic to your website, through ads, basically on the website. Um, Being a blogger or like writing blogs would take a lot of effort and a lot of time to reach a lot of people. So it's a like a numbers game. So I think I was rushing for the results. That's why I quit early. But after that, that was the start of my company, which is Simplified Pharmacy. So it started as a blog. And then I moved on to doing courses. So like that's fast forward to 2024. Um, I started doing courses, but the idea of it came from the struggle that I faced. So I did two courses. One of them is a pharmacy assistant training, and the other one is a pharmacy billing training for Ontario specifically. So I started with the pharmacy training program because when I volunteered in 2019 as a pharmacy assistant, When you work in a busy pharmacy, no one will have the time to teach you, show you around, like tell you how things work. So it was very overwhelming. So you kind of learn as you go on your own, the majority of the things. And I found that a lot of people also struggling with this. So that's why it inspired me of creating the first program, which is the pharmacy training program. So I started in 2024, and now I have over 1,500 people joined already. Every day, new people would join. And that was that for that program, and it's still going on. And in 2025, so this year, I created the Ontario Billing program. So what inspired me was again like the same idea, my struggle, because I was struggling with billing as a pharmacist, as a new pharmacist, because like billing specifically, no one ever teach you billing. Like it's something that you have to learn on your own. And Ontario billing, like it's a complex system, like compared to some of the provinces. So that's why I created the program. I know some people would say that like you don't have to learn billing, it's not your job, it's not your responsibility, but I disagree because like in my case, I used to work as a relief and a lot of time I would work alone. So like if someone hands me a prescription with insurance, like you have to deal with it. And when I was working as a relief and that situation would happen, like someone would drop off a prescription, they have insurance and I'm alone, and I don't know like how to enter the information into the system. And if so, like if there's any error, I don't know how to fix it. So like it takes a lot of like also mental effort, right? Because like you know your stuff, like the medications, the counseling, the medical stuff, but like you're missing out on a important piece. So that's what inspired me to create the Ontario Billing Program.
That's amazing. First, allow me to actually commend you on this fascinating journey because I actually also relate to it because especially since like your first steps were not in the field of pharmacy or like the field of healthcare, it was actually something outside that field, more business centered. And then like you didn't give up. You kept that at the back of your mind, and then eventually you turned it into something that would like you found basically a niche in the field of healthcare and like you addressed whatever gap that we had in the field of pharmacy and like created a product which basically addressed that gap. Also, I wanted to address the Ontario billing course, which you talked about. I actually purchased it yesterday. And I finished the first two modules. I really like the course that you have actually created, especially the intervention codes and like codes like MG, AU, if I'm not mistaken, something like that. I actually had no idea about that. So especially like intervention codes, basically when it comes to billing blister packs, like every 7 days versus a month when it comes to billing like needles, 200 needles versus 100 versus more than that. So that was actually an eye opener. And I really appreciate you putting such a course together.
Yeah, thank you. I appreciate it. Yeah, because as I said, like the billing in Ontario is somehow a little bit complex because like there are a lot of rules, there are a lot of stuff that you need to like have in mind when you deal with insurances. So that like I think yeah, that's why I created it.
Yep, that's definitely like I actually see like this course will become more in handy, like especially as more pharmacists move towards like community and even clinical care. Like billing is always a crucial component, because like when a pharmacist knows how to bill, then that um, makes the pharmacy like more efficient because the pharmacist is less reliant on pharmacy techs and pharmacy assistants for help with billing. So it makes like a more efficient, I want to say, corporation.
Exactly.
Moving over to the next topic. So I know that content creation is like staying consistent with content creation isn't something that's always easy. And like especially me when it comes to creating like filming episodes actually for my YouTube channel. So like always finding guest speakers, always like being motivated to actually, keep the grind and all of that. So what challenges would you say have you faced like in building your platform, and how do you keep yourself motivated?
So like the thing is when you start content creation, the first, like I would say, like when you have a new account and like you have like zero followers or zero subscribers, it's very hard to stay motivated to keep on posting stuff, whether it's LinkedIn or YouTube, because like you post stuff and you don't get any results back. So like you don't have the dopamine basically hit. Like when you post stuff, like you would think that a lot of people would engage right away. You would have a lot of subscribers, a lot of impressions on the posts, but like that's not the case, and it takes a lot of time to build like basically followers or subscribers. So it's not about the motivation. I think it's about the discipline. Like you have to like just show up and do the same thing every day. And I think also in my case, I was very distracted because like I would have a lot of ideas about different things and I want to execute on them, like all of them right away at the same time. So like I guess a lot of people will also struggle with that. So I try as much as I can to focus on one thing, but it's hard. But like, of course, look, we have to try. Just focus on one thing at a time for a period of time. And if that thing didn't work, you have to just switch it up.
Yeah, that's something I agree to. Like, especially when I first created my YouTube channel, like at first I was addressing like several guest speakers from different programs, and then eventually I just like focus on guest speakers from the healthcare profession.
Exactly. Yeah.
So moving over to our next question, how do you balance your professional responsibilities with your creative work? Like basically working in a pharmacy and working towards like building a course on your platform, Simplified Pharmacy.
Yeah, so like in my case, my shifts are a little bit different because I work longer shifts, fewer days. So my shifts are 12 hours. So like I work 3 to 4 times per week and I would have some days off because like basically I work the 40 hours in a week, but like longer days, longer hours, smaller days. So on my day off, I try to utilize that as much as I can. Like you have also to spend like time with your family and everything, but like I try to find some time every day to just like be ahead of myself, like post whether it's like to prepare content ideas per schedule posts or basically like try to get the ball rolling. But sometimes that's not always the case because like life would get busy and you don't have time. But um if you have any time, like spare time, even if you're like working out or in gym or having a walk, those are the times when you get some ideas. And I would always have my notebook on my phone to just write down those ideas because I know I will forget them. And by the way, like the courses was one of those things when you're like sitting down and you're like, aha, like the aha moment. And then you're like, you write it down in a notebook. And then when you have time to do the research on the thing that you wrote down, right? And that can turn into something.
Yeah, that's actually inspiring. Now, moving over to like more community practice and vision, how do you currently view the role of community pharmacists in Canada, and like where do you see it going in the next, like let's say 5 years?
As a community pharmacist, we play a crucial role in the safety of the patients. Like the other day, for example, I'll make it quick. I had a prescription for amoxicillin and naproxen for a pregnant lady, and the dentist didn't tell the patient like the risks of taking medications in the pregnancy. And naproxen was actually like in the third trimester was it has a lot of contraindications according to like the resources I checked. So I told the patient like taking naproxen third trimester would have harm. And I ended up recommending something like Tylenol regular strength. So basically what I'm trying to say is like being a pharmacist, you are kind of the first and the last line of the treatment because like a lot of people would present the prescription and they don't even know what they have written, right? But with that being said, sometimes we have a lot of pressure from a lot of resources or people. Um, but I see I see a good future. I'm speaking in Ontario specifically because this is like where I work and where I'm planning to continue working. There are a lot of expansion in the scope, which I like, but sometimes that would add some pressure also to the pharmacist. Especially like some people would also see it as you can prescribe something, then you have to prescribe it to me. Like they don't see that you have to assess the patient and see if they are eligible or not. But those are the small things, right? But like overall, being a pharmacist, I think it's very rewarding. But you just like have to be in a tough mindset because like you will have a lot of low moments from people, from patients. But you like you have to like to say it in a nice way, like you have to stand your ground sometimes, basically, and you have to see what's right for the patient and also for yourself. Because like at the end of the day, you are licensed and you want to keep your license. So I guess like yeah, I
Yeah,
guess
so
that
basically,
summarizes it.
yeah. So basically, like acting in the best interest of the patient while like complying with the rules and regulations of the province as well.
Definitely. Definitely.
Now, coming over like to one of our final questions, how would you say, like actually some suggestions you would give to pharmacists to better position themselves as essential healthcare providers in their communities?
Yeah, like as I said, like we are somehow the last line of like the patient because like after they see the doctors, they present the prescription. So you have to be up to date on the information, on the guidelines, like the medical guidelines, hypertension, diabetes, whatever. So like you have to be up to date. And also like you have to keep in mind like those patients are struggling because like they are patients. So you have to keep that always in mind. Sometimes they are frustrated because they are in need of help. So you have to know your stuff, know it very well, and know how to deliver the information to the patient in a very plain, simple terms. Uh, like versus telling the patients like the big words like diabetes, hypertension, whatever. So I think I lost the camera here. Okay. So I guess yeah, like you, as I said, like we have to be up to date, we have to be kind, and we have to basically think in the position of the patient, like see it from the patient's point of view.
Yeah, I definitely agree to that. Just a final question. So, what are some recommendations you would give to newly graduated pharmacy students who are entering the profession, and also some recommendations for pharmacists who are interested in content creation?
Yeah, like for pharmacists who are newly grad, you have to try different things. So you have to try community or hospital, like you have to try different things to know which one is for you. So that's basically my short answer for content creation. I guess it's not for everyone, but like if you are a person who tries to pursue content creation, you have to start right away and then learn as you go. Because like I took years in planning and I didn't execute. So like planning doesn't really like it's useless until you execute. And there is no way for a person to learn everything without acting. So you have to do the thing by yourself so that you learn if this is the thing for you or not.
Amazing. Yeah, thank you for those advices, and thank you for being a guest speaker on my channel.
Amazing. It's my pleasure, and I had so much fun today.
Thank you, me too, as well.